My name is Ji-So Yoon. I'm Associate Research Fellow at the Center for International Development and Cooperation at Korean Women's Development Institute. I will be moderating today's webinar. I'd like to extend my warm welcome to all the presenters and participants to the webinar on humanitarian challenges and gendered impact, vulnerabilities and capabilities of women and children in DPRK. This forum is co-hosted by Korean Women's Development Institute and the Institute for Security and Development Policy in Sweden. Our institute, KWDI, has been working very closely with ISDP in Sweden in the areas of peace and security since 2018. Humanitarian challenges of DPRK has been one of the issues that both institutions have been very eager to collaborate on. And our ideas have been it came into being finally today as this format, as an international webinar that discusses humanitarian challenges of DPRK with a specific focus on gender. Our aim is not simply to look at the vulnerabilities of women and children, but also evidences of their assets and capabilities and resilience under the harshest circumstances. And as you may have noticed from looking at the program, we have invited 5 very renowned scholars and experts in this area to speak. I hope you will enjoy their presentations. And please feel free to keep your questions and discussion points, as I will open the floor at the end of the webinar when all the presentations are over. Before we get into expert presentations, I would like to invite President Moon Yu-kyung of Korean Women's Development Institute to deliver her warm welcome remarks. Please let me introduce her.
안녕하십니까? 한국여성정책연구원 원장 문유경입니다. 바쁘신 일정에도 한국여성정책연구원과 스웨덴 안보개발정책연구소가 공동으로 개최하는 웨비나에 함께해 주신 여러분께 감사드립니다. 오늘 웨비나는 북한 내 여성과 아동의 인도적 위기 상황에 대한 정보를 공유하고 북한 지역사회의 역량을 고려한 향후 지원 방안을 모색하고자 마련되었습니다. 남북관계 경색 국면이 장기화되면서 북한과의 협력 사업은 대부분 중단되었습니다. 지원 사업 역시 평양 내 유엔 기구를 통해 최소한으로만 이루어지고 있습니다. 현재 북한은 만성적 자연재해와 식량 부족이 매우 심각한 상황입니다. 대북 제재와 코로나19 팬데믹이라는 유례없는 위기는 북한의 여성과 아동의
the country and the unprecedented global COVID-19 pandemic are making harshest impact on women and children in DPRK. The crisis in DPRK is well reflected in statistics published by UNICEF. The situation is expected to be worse in the future. This forum hopes to identify the crisis in DPRK and how women and children in the country are overcoming the crisis using their capabilities. By doing so, the forum hopes to develop ideas of humanitarian assistance when the sanctions against the country are lifted. I also hope we can build consensus on humanitarian assistance to women and children in DPRK in this forum and come up with substantial ideas to contribute to assistance efforts of civil society in the future. The KWDI and ISDP signed a business agreement in 2018. We have exchanged ideas actively by jointly hosting academic events, for example. I look forward to a stronger network between the two organizations and wish you all the very best. Last but not least, I'd like to thank today's speakers, Sang-Soo Lee, Deputy Director and Head of Stockholm Korea Center of ISDP, Nagi M. Shafiq, Public Health Advisors, Margaret Westrom, former President of Swedish Red Cross, and Ju-Hyun Executive Director at the Medical Aid for Children, and Eun-Ah Chang, the Director at the Center for International Development and Cooperation of KWDI. I'd like to also thank all the staff of the KWDI and ISDP for their hard work to make this webinar possible. Thank you very much.
Thank you very much, President Moon Yu-kyung, for your introductory remarks. Let's begin the program without further delay. Now, I would like to invite the 5 speakers to speak on the issue of humanitarian challenges in the DPRK, but particularly focusing on the challenges facing children and women. Because we have limited time, I would like to ask all the speakers to keep your presentations to a maximum of 15 minutes. And please keep in mind that I will be checking the time while you speak, and I might ask you to wrap up your presentations if you seem to be running out of time. So our first speaker is Dr. Sang-Soo Lee, Deputy Director and Head of the Stockholm Korean Center at ISDP. Dr. Lee will be presenting on the theme of humanitarian situation in North Korea and the impact on women and children. Dr. Lee, are you here? Please.
Yes, thank you very much for having me today. I'm very happy to join today's webinar, also as a first speaker. And I'm going to provide an overview of the current economic situation in North Korea and its impact on women and children. Before I start my presentation, I would like to mention that we have so little information about internal situation in North Korea because almost all foreigners left the country, and we cannot access North Korea during the pandemic. So very frankly speaking, it is very difficult to say that North Korea is now facing an economic crisis or it will face such crisis anytime soon. Surprisingly, Pitch Solution predicted North Korea's economic growth this year is 0.5%. Meanwhile, it estimated economic growth last year was minus 8.4%. So according to Pitch Solution, or if these figures are reliable, North Korea's economy is quickly recovering or rebounding from the first COVID shock, like the rest of the world. One more reason is that I think North Korea had a huge damage of flooding and typhoons last year, but such natural disaster hasn't arrived in the country this year yet. Furthermore, according to Yonhap News yesterday, the Sino DPRK trade volume in September this year increased by 140% from this July. It didn't say much details, but I do believe that this is because of the recent increase of maritime trade between China and North Korea. Mainly North Korea's export of coal and selling its electricity to the Chinese side. Actually, China urgently needs 2 items now, coal and electricity, since 20 Chinese provinces are now suffering from the electric power shortage due to the lack of domestic coal production. Therefore, although the border trade with China hasn't fully been resumed yet, especially through the land. It seems North Korea could avoid the economic crisis, and then even the national economy could continue make small growth in the upcoming years. Having said that, unfortunately, ordinary peoples in North Korea, their livelihood and daily life are quite different story. And one thing, it is very clear that many North Koreans are still very much suffering physically and mentally, because the regime has imposed the world's toughest internal lockdowns and the longest COVID restrictions since last January. I would also like to emphasize that every country, normally vulnerable groups, especially women and children, are more affected by national crisis, and North Korea is surely no exception. Now, I will give you more detailed examples how the sanctions, the long-term border closure, and the internal pandemic restrictions, how negatively influence North Korean people's life, especially women and children. First, the impact of sanctions. Since 2017, the UN has banned North Korea's major export items, such as coal or iron, textiles, and fisheries, which provided major incomes to the regime. However, it has also been unintentionally affecting ordinary North Koreans, especially women. Because in the recent years, many women lost their jobs who worked at the factories in those sectors. For example, 90% of workers in textile factory are women. 100% of fish net makers are women, and 70% of fish farmers are also women, as well as 60% of electric car operator positions in the coal mining sector are women, according to the report published by Korea Peace Now in 2019. On the other hand, some 100,000 to 150,000 North Korean male workers who worked abroad, they had been repatriated to home in the last 3 years under the UN sanctions. This has also impacted North Korea's domestic labor market, and it made more difficult for women to find their job. The second factor, I think, is external border closure with China. As we know, North Korea has sealed its external border in order to prevent from entering the virus in the country. So the border trade with China and the people's cross-border exchanges now have fully been banned since last January. As a result, this move has heavily undermined not only the national economy, but also individual household economy. For example, firstly, average market prices for rice, pork, oil sharply spiked this year due to the lack of import of food and energies from China. This has become a heavy financial burden to the most of households in North Korea, I would say. And secondly, the sealed border has prevented the humanitarian aid, of course, some food and medicine getting through. Most NGOs have had to leave the country, now unable to get staff and supplies in. But the main problem is the most victims for this move is women and children, as they are in need of those most of humanitarian aid. Thirdly, due to the closure of borders, many females who were involved in cross-border business, such as peddlers, have struggled to deal with the loss of their income. As a result, some women are involved in criminal activities such as drug trafficking and prostitutions for making their money to feed their family. Lastly, over the past 2 decades, a significant number of North Korean women had crossed the border with left behind their family members, mostly illegally, for the purpose of making money for their family. In average, North Korean migrant mothers working in the healthcare sector, restaurants, and even massage shops in the Chinese side of the border. However, after closure the borders, they are not able to return again. And even they cannot send the money to their family members. Not only the external border control, but also internal lockdowns, such as the ban of people's free movement and the limitation of domestic transportation, have heavily impacted on people's daily life in North Korea. For examples, firstly, the quantity of food in the markets is now less, and the quality of food is very, very bad due to the internal travel ban, cutting off the connection between farmers and customers. So there are less food and stale food on people's dining table now. Meanwhile, the farmers' income has also decreased due to the lack of their market access. Secondly, in the past years, North Korean women increasingly take their responsibility for family survival, and they had heavily relied on private market, selling food and basic housing productions. However, by imposing North Korea's COVID restrictions, the government has closed a number of private and strict markets. Actually, the total number of female sellers in the street market was estimated at over 1 million in 2016. Thirdly, because of the ban of free movement, the country's distribution system is not functioning very well now. And this is making more gap between rich Pyongyang and rural areas. For example, Nampo, located just 65 kilometers away from Pyongyang, is currently the only open harbor in North Korea to receive foreign products and aid. Therefore, most goods arrive in Nampo primarily delivered to Pyongyang, but not other remote rural areas. So this is because of the strict control of domestic transportation, but unfortunately, actually, people in rural area, they need more humanitarian aid. Finally, most schools in North Korea, from elementary to university, have continued closing down since last year, and it is likely to continue until the end of this year. This has given a lot of burden to moms because they have to take care of children at home, but they still have a responsibility for families' economy. Furthermore, the delay of reopening schools has undermined the conditions of children's nutrition, as schools and daycare are main providers nutrient meals to the kids. Actually, I talked a number of too many negative factors affecting women and children in North Korea, but there are actually so little options now to improve the situation. I think that the long-term solution is, to reopen the border with China or nuclear negotiation with the US to lift the existing the sanctions. However, I think this is not gonna happen in a short term since global pandemic is not likely to be over anytime soon. And distribution of vaccine for majority North Korean people would be delayed. Also, the US is not going to offer the sanction relief soon, as long as Pyongyang is developing its nuclear weapons. I stop here. I talk too much negative things, but I hope other later speakers to bring up more positive ideas and suggestions. Thank you.
Dr. Sang-Soo Lee, for your insightful presentation. I think it highlighted mainly the impact of sanctions, in particular, how it has affected women's labor force participation in North Korea, and how it ultimately has affected the national economy as well. Thank you, and I look forward to the discussion at the end. Now, I would like to invite the second speaker of today's webinar. Our second speaker is Dr. Nagi Shafiq, who is a medical doctor as well as a public health advisor. The title of his presentation is Vaccination Capabilities of the DPRK and COVID-19. Dr. Shafiq, are you here? And I heard that you would be sharing your PowerPoint slides, so please get ready to do that.
Okay.
Okay. All right. Do we have Dr. Shafiq? Yes, we do.
Okay. Okay, you got it. Okay, so as you mentioned, I'm going to talk about the vaccination capabilities in DPRK and the situation of COVID-19. Before that, I'll give you a historical background about the program. The vaccination program mostly serving women and children. And according to the Ministry of Public Health, the first vaccine manufacture plant was founded in February 1946. It was followed after that by 2 vaccine manufacture plants also. 10 different kinds of vaccines were produced, including BCG, DTP, measles, polio, rubella, Japanese encephalitis, and other vaccines. But due to the mid-90s crisis, the vaccine production also was affected and deteriorated. But since 1995, we are only producing limited amount of polio, measles, BCG, and hepatitis B. The expanded program on immunization was launched in 1980, supported by UNICEF and WHO. Together with the Ministry of Public Health, they form the Interagency Coordinating Committee that meets at least once monthly. The program is managed at the central level by the Hygiene and Anti-Epidemic Institute, and at provincial and county level by the Hygiene and Anti-Epidemic stations. including also a national system to monitor the adverse effects following immunization. Now, most vaccines are procured through UNICEF. Gavi started its support to the program, like giving BCG, DTP, polio, and measles in 2002, and introducing hepatitis B in 2003, which started by 25% of the country, but from 2004, it's covering all the country. The government of DPRK is covering 15% of the vaccine cost and 30% of the routine immunization program cost. Now, just here to give you an idea, this is the vaccination schedule in DPRK. And as you see, almost all the vaccines are for children, and except the tetanus, diphtheria, for pregnant women. Now here, the vaccination distribution system. Sorry. Okay, here how the vaccine are distributed from the central level to the lower level, usually from the central cold room using cold trucks to the provincial and cold rooms. And from the provincial cold room using also smaller capacity pickup cold trucks to the county refrigerators and deep freezers. And the count to the re-level is collected by the section doctors on the immunization day using ice boxes. Prior to the immunization day, the section doctors remind households to bring the infants eligible for the vaccine like polio, DPT, or hepatitis, or measles to the re-clinic. Also, disposable syringes and safety boxes are distributed through the central medical warehouse to the provincial and county level, and then to the re-level. The UNICEF and WHO have been supporting the EPI program, including technical advice, capacity building, cold chain equipment, and supplies, like means of transport, refrigerator, freezer, cold boxes, ice boxes. And a continuous supply of electricity is required to ensure uninterrupted cold chain and to overcome the lack of the irregularities of electricity in certain areas in TPRK. And with funding from European Commission for Humanitarian Aid, solar refrigerators were proposed in 2003, and a pilot project of providing 50 solar refrigerators to county hygiene and anti-epidemic station was completed in 2004. This was done by support of the UNICEF Supply Division in Copenhagen, with technicians from Copenhagen helping in installation and training of Korean staff. There are always a regular review of UNICEF of the cold chain, mean of transport, and other equipment, accessories. Usually such reviews and inventories are used to identify the need and replenish to maintain the integrity of the cold chain. Now, maybe you have heard that heard about the high coverage of vaccination in TPRK, and some people find it a bit strange. But here you can find just here the coverage of DTP3 from 1980 to 2013. And you can see two lines, the light line, the upper light line, this is the government reports. And the darker line, this is the WHO UNICEF estimate, and the column is the verification data quality audit done by external auditors. So you can see that before the crisis of the mid-90s, the red arrow, the horizontal red arrow, that the vaccination coverage was high, but this is unverified. And you see also the other vertical red arrow that after the crisis, the vaccination dropped, the coverage dropped substantially. And then in December 2004, the Joint Mission for Data Quality Audit on behalf of Gavi, they made an assessment and visited 4 counties and 24 health facilities. And the provisional verification factor was reported as 0.93, which is well exceeding the threshold for acceptable accuracy of 0.8. Also, the report stated that the immunization reporting system is well designed, functional, and information was easily retrievable at all levels. There was a high degree of completeness of reporting. Documents were stored properly, and staff were in general aware of the reporting procedures for immunization, vaccine, syringes, and adverse effect following immunization. Now there was, in the winter of 2006-2007, there was a measles outbreak in DPRK, the first over a decade, resulting in over 3,600 cases and 4 deaths, 2 adults and 2 infants, in 30 of the counties of the country. The first cases were initially believed to be rubella, as measles had not been reported in DPRK since 1992. And many of the country health workers were unfamiliar with the symptoms. DPRK asked for help from IFRC, the Federation for Red Cross, and UNICEF and WHO. With technical and funding support from UNICEF, WHO, and IFRC, a vaccination campaign was carried out in 2 phases. First phase, from March 14 to 18, 2007, 6 million people were vaccinated. The average was 1.2 million a day. Second phase, from April 9 to 11, 10 million people were vaccinated, daily average of 3.3 million a day. In addition to the measles, all participants received a dose of vitamin A that was supplied by the International Federation for Red Cross. Estimated cost of the campaign was 8.5 million. DPRK covered 2.5 million, almost 30%. This experience showed that DPRK is capable of implementing national vaccination program both quickly and efficiently. Now, it's very difficult, again, to tell about the situation of in DPRK, especially now with no NGOs, no international agency there. However, we are going to talk about the facts concerning the COVID-19. As explained before, also the borders were sealed in the beginning of 2020. The managers of health there, they must have their own reasons to close the borders. Maybe they learned something from the experience of SARS 2002 and measles in 2006, 2007. And then also, there is also another issue that if the disease spread there, it will be devastating of the health system. The WHO provided some PCR tests And the latest figure of tests performed as per the first week of October was more than 41,000 tests, and there was no positive cases. DPRK is one of the countries signed with COVAX. Before, there was promised 1.6 million of AstraZeneca, but for some technical issues with the Serum Institute of India, there was no export because of the need of India. However, they also refused recently 3 million doses of the Chinese vaccine Sinovac, saying that they asked that to give to other country in need. The situation of women and children is always, for example, if you follow the successive national nutrition assessment, it showed that substantial improvement in the children malnutrition indicators. Nonetheless, it didn't happen the same improvement in women. And you still have the anemia prevalence among women of childbearing period is about 30%. Of course, there are many reasons for that, and it needs more in-depth analysis, including overwork, bringing water and wood, delivery, taking care of children, even giving their own food to the children. Of course, sealing the borders, as explained by my colleague before, this is just like closing the lifeline of the country's economy that is already exhausted by unprecedented sanctions. After almost 20 months, this could have its toll on the nutrition and the regular health services, especially of child and maternal health, like regular vaccination program, disease of children like respiratory tract infection, diarrhea, and delivery of women. However, the good news is that the WHO and UNICEF shipped some items, including emergency health kits and medicine, to Nampo port. Now, about how the COVID vaccines and DPRK cold chain capacity. The current cold chain in DPRK can deal with any types of vaccines except those of mRNA that needs -20 or -70. Before starting the vaccination campaign, we need preparation like inventory and assess on the cold chain, technical, logistical preparation. Some equipments might need repair or replacing. In case DPRK would use the messenger RNA that need ultra cold temperature, I think that the UNICEF can provide this special refrigerator as they did in other countries. The DPRK immunization program, together with the Korean Red Cross, is well organized with the support of partners like IFRC, UNICEF, WHO, Gavi, and logistic and technical preparation to update the cold chain, and mobilization could be finalized in less than 2 months.
Dr.
It's expected. Sorry?
You have a minute to wrap up, please.
Okay. The target groups would be as expected, the health staff over 65 and people with chronic diseases. This is the possible scenario as written by infograph written by my colleagues in the article, our article in 38 North. Now, finally, these are some photographs from the cold chain items. This is cold room from inside, solar panel, solar refrigerator, cold trucks, and a fridge tag that record the temperature. Thank you very much.
Thank you, Dr. Shafik, and I'm sorry that I have had to ask you to wrap up quickly. I mean, it was a really nice presentation to hear about the vaccination situation in North Korea, and it's definitely one of the rare opportunities for us, people in South Korea, to be exposed to this kind of information. And I should have mentioned when I introduced Dr. Shafik to you that he has been working in DPRK from 2001 till 2009, first for the UNICEF, then for WHO. And so that's one of the reasons why Dr. Shafik was able to give us so much information, rich information about the situation in the DPRK. Thank you for that, and I hope we have a chance to talk more about the kind of health situation facing women and girls in North Korea, particularly during our Q&A session. So now I would like to move on and ask the third speaker. I'd like to invite Ms. Margareta Wallström, who is the former president of the Swedish Red Cross and former special representative of the UN Security Council for Disaster Risk Reduction. The title of her presentation today is Women in DPRK, the Impact of the Humanitarian Situation and the Role of Women. Ms. Wallström, are you here?
Yes, I'm very much here. Thank you. Do you hear me?
Yes, please go ahead.
Yes, good.
Yeah.
Okay, thank you so much. And I also like to thank Dr. Sang-Soo Lee and Dr. Shafi for the excellent presentation, giving very concrete perspectives on the situation in DPRK. And just like Dr. Shafik, I will also try to build on, rather, as Dr. Sang-Soo Lee asked us to give some more positive messages rather than what he felt was picking up on all the negative things. But my experience with DPRK and the Red Cross, as Dr. Shafik also already mentioned, goes back to the big crisis in the mid-90s. And that was, in fact, the first time that DPRK requested international aid in a very severe economic crisis after its partners, mainly the Soviet Union, the economy collapsed after the fall of the regime there, plus a series of very destructive natural hazard events. Flooding, typhoons always have a very severe impact on DPRK. It's a very deforested country. It's mountainous. It's not really a great agricultural economy because of the natural outlet, but people in the rural areas are, of course, highly dependent on their agriculture income. So that crisis in the mid-90s for the first time allowed us to get to know the country, but also to, as we were visiting, to see the absolutely horrifying impact of the situation at that time. Many of you will remember the images of people terribly malnourished. And in conversations with people, I also, if I start on the women's situation from that period, I commented to some women that I met during a visit that I couldn't see so many young children, young babies or small children. And they said, no, we have very few children now because essentially because of the nutritional situation, women try to limit the number of children, but they also actually did not get the monthly period. So they were not very fertile because of being malnourished. So from that really terrible period, of course, things have improved dramatically if you look at the situation even today. And in order to look at women's capabilities, I took a look at the official data on population in just to see the basic figures such as life expectancy for total population, for compare women and men, population growth. And it's very consistent that the data for women in North Korea follows the pattern in so many other countries, that women have consistently longer life expectancy than men. Very low birth rate, barely replicating the population. In Sweden, for example, our population tends to diminish, as in China and Japan and many countries. So I look at this as something quite positive in the sense of women in DPRK having the strength and resilience, and they are managing their very stressful life situations with this basic strength, I should say. But as we also know, DPRK, even if there isn't any typhoon or disasters or border closures, the absolute majority of the population live in poverty, and the rural population really now, visually, if you visit the country, if you visit Pyongyang, which, like people say about New York is not United States. Well, Pyongyang in a way is not DPRK, the people's life situation. If you visit the rural areas, you will also see that it's hard labor. It's scraping the land for some proper means to live on. But with the international cooperation, with the economic reform, which was allowing private market, which enabled women, as Dr. Sang-Soo Lee, to start trading, you can also see the innovations and the creativity of women to create an income that make life easier for people. But I usually say that even in very positive periods, people in DPRK overall, and particularly women, children, and elderly people, they live very close to the limit of good health. So a disruption, as we've seen now, a disruption by disaster, a disruption by closed borders, will immediately jeopardize the health and welfare, with dire consequences, of course, for the capacity of living a decent life. So from the humanitarian perspective, and I would say, like Dr. Sang-Soo Lee, information is very hard to come by when we are not there, when we are in the country. Of course, we have these days quite good cooperation also with national authorities, as is proven by the good information about the health system. DPRK has a very good network of public health system. It's just that it doesn't have much in it. It has staff and physical facilities, but very little medicine. If you visit one of the rural clinics, you can see the UNICEF fridge, but it's normally empty, unfortunately. And then for the rest, it's very basic, a lot of traditional medicines, and the rural doctors and nurses are trying to do what they can for people. But that is the reality that most people live with. So in the humanitarian system, because of the international sanctions that are very, very restrictive, the sanction system for DPRK is one of the strictest in among the many sanction systems that the UN and member states have imposed. And that means that we also have, as humanitarians, we have to be very focused on what sectors we are dealing with. It needs to fit, let's say, the definition of what is life-saving. So it will be health, fortunately. It will be clean water. And of course, for an agency like the Red Cross, it will be a lot of focus on strengthening the support to the disaster agencies, the DPRK Red Cross system, ensuring they have stocks, that they can train first aiders, and that they always have a readiness locally to support people in the instances of a disaster, and they happen all too often. And I would say that with the support of the UN agencies, the Red Cross, over the past 20 years, there has been a considerable strengthening of people's basic resilience and ability to withstand even regular disruptions to their life. So it's a system that is somehow functioning quite well, but every time there is a major disruption, it of course threatens people's health and welfare. I think Dr. Sang-Soo Lee mentioned the very interesting article that Dr. Sung-Kyung Kim has written about women's economic role. And I think that even though it's disrupted now, it really opens a fantastically interesting perspective on the future. Because in every country in the world, what really makes a difference for the role of women in society, even in a strongly patriarchal society as Korea is described, is when women become economically independent. That changes gradually the ability and the opportunities for women, because society recognizes not only that women are very capable, but also that they are needed. This evolution has, of course, been it's been seriously disrupted by the border closures. So I would say, I will talk a bit about the consequences of the COVID, because, you know, when you listen to Dr. Shafik describing the system, the absolutely possibility for the country to do an effective vaccination campaign in a couple of months, you ask yourself, but why don't they do it? Why doesn't it happen? Vaccines have been offered by the UN, by bilateral partners, by the Red Cross, but the answer is no. So that is maybe something that we can come back to, and I think Dr. Sang-Soo Lee also probably has some thoughts to share on that topic. So the potential is there, and yet what we know about the health of women and the health of children, the UN and the humanitarian agencies, we do an annual assessment of what is the number of people needing in some kind of support in any country, and also DPRK. And that figure has been steadily now for a number of years. 10 million people need some kind of support in DPRK. And I'm saying some kind because the UN, there is no longer any general food distribution. It is very targeted nutritional support to women, children, elderly persons. So it is to sustain that level that I mentioned before of a reasonable barrier to falling across and becoming a risky situation. And children's, as also already mentioned, the children's nutritional data has steadily improved as well. But this fragility in people's life is the big risk in the DPRK. And the question for all of us now is, of course, what are the consequences for the humanitarian needs of the people in DPRK with probably more than 2 years of border closures? The UN and the Red Cross and 2 international NGOs kept international staff in the country until early 2021. But by that time, they had no money, they had no possibility to really move in the country. They actually could not do their work, so they decided also to leave. And that means that all our cooperation now is online and distance. In the Red Cross, we do have an office which remains open and functioning with nationally employed staff. and they are supported by a group of international Red Cross people sitting in Beijing and other places around the world. But so that works reasonably well. The major issue for us is that we cannot get supplies into the country. The borders are closed. That means that the supplies and the stocks that were still in the country have been depleted. Since we cannot get money, there is no banking channel, so we cannot provide any financial means for the operations to continue in support of what the National Red Cross Society is doing. And that means that we are somehow accumulating debts because we can buy supplies on credit, but not forever, not even in DPRK. So the whole situation is becoming very tenuous in terms of being able to sustain activities. So that's very practical things. What is more worrying for all of us is that for the past, I would say 15 years, humanitarian assistance from international donors have continually dropped for DPRK. Is this a result of many competing crises in the world, or is it the result of geopolitics, or is it a result of that people judge that DPRK should be managing itself better than it is? But the reality, whatever the answer to that question is, our worry is now, all of us, that once and we assume DPRK will open up, it maybe have changed policies, but we believe they would like to continue cooperating with all of us. We cannot really for sure say, will we meet an escalated humanitarian crisis? If we listen to the messages by the leader of the country, that might be the case, but on the other hand, the economy seems to be opening up a little bit. There's some exchanges cross-border with China. So perhaps we don't have to meet that big crisis. But gradually and how quickly it will be possible to start understanding that again. We don't know now. It for sure will not be this year. It will probably maybe not even early next year. So the question is, will those that contribute to keep our humanitarian operations work, will they still be there and ready to assist? So far, in the case of the Swedish Red Cross, yes, we do continue to have an excellent cooperation, not least with our government, because Sweden also is, as a country, is trying to sustain the relationship for positive reasons. But there are many, many question marks and not that many good answers. For the time being, the entire humanitarian system, the Red Cross, I'm sure the UN, and other civil society organizations, we are on standby, but with a very high degree of preparedness to act when and how it becomes possible. And we will remain like that because we know the situation for the 10 million that we have supported in one way or the other for many years now will be 10 years. But the capability, as I said, when you look at women's situation over many years and how they managed to sort of move out of their role through the economic growth, I think we should be very optimistic about the future of women in DPRK. And finally, I will just share with you, a couple of years ago, I visited DPRK and the Red Cross Society there. And I asked them if we could introduce an initiative that we have in the International Red Cross movement, where we try to encourage women to step forward into more senior positions and more senior roles in their national societies. So this has been an outreach, and we present the idea, we demonstrate through statistics how very few women there are at the top level in the organization, and ask ourselves why. when well over 50% of the volunteers are women, why don't they reach the top in the organization? So of course they said, yes, you're welcome to make that presentation. And I was deeply impressed by many people came to the meeting. They were called to the meeting, women and men, the head of human resources management. And it was like, it's a quiet enthusiasm in the room that was very positive. So for me, that is also a sign of that there is an understanding and an interest in that women's progress means many things, but also in these kind of organizations, we will have to make efforts to create more space for women, and women will have to get the courage to actually take their place. Thank you.
Thank you. Thank you very much, Ms. Wallström, for your presentation. It was a very rich presentation giving an overview of realities in North Korea in different areas, really. It was interesting to hear about the realities in rural areas and then the realities of women. I was particularly impressed and surprised to find that this current trend of women marrying late and fewer marry, having less children than before. There was a lot about the current situation in North Korea, particularly focusing on women, and we should definitely talk more about this during our general discussion. Without further delay, let me introduce our next speaker. Our next speaker is in South Korea with us here, Dr. Juyeon, Executive Director of Medical Aid for Children. I'd like to invite Dr. to begin her presentation, and her presentation is titled Humanitarian Situation, Assistance and Challenges of Women and Children in the DPRK.
네, 안녕하세요.
Good morning, good afternoon, and good evening. Let me finish in time. I will do my best. As introduced, my name is Juyeon. I've been working for the medical aid for children since 2002. And 10 years later, from 2002, I started North Korean studies. I wanted to explore ideas about how to assist women and children in North Korea. I'm an activist and I'm also a researcher. And Medical Aid for Children was established back in 1996, and many healthcare workers provided their support for this medical aid for children. And in 2001, the name of the organization was changed to Medical Aid for Children. The Medical Aid for Children started its business with North Korean Research Institute for Nutrition Corps of Children, and it also provided supplies to Daedonggang River District People's Hospital, and it provided support and other medical equipment to maternal health, and we also helped North Korea to refurbish some of their hospitals. In early 2000, we also provided support to build a children's hospital in Manggyeongdae. So since 2002, we've been providing assistance, especially humanitarian assistance to North Korea every year. But it was followed by a difficult period because there was the deadlock between inter-Korean relations. And from last year, we haven't been able to provide our assistance to DPRK because of the global COVID-19, global pandemic of COVID-19. In 2008, when we resumed our business against the backdrop of the UN sanctions against North Korea, this is the history of the inter-Korean exchange. It started back in 1995. North Korea officially asked for UN's humanitarian relief in that year, and a conservative regime and administration took the power in South Korea, And then that was followed by Kim Jong-un's presence in North Korean regime. In 2016, the Kaesong industrial complex was shut down. And in 2018, the inter-Korean leaders had 3 summit meetings. And they made 2 joint declarations. And the cooperative project stopped back in 2018 due to the political situations. When it was regime, initially there was a short-term projects, but since then there have been a long and mid-term assistance programs. So medical aid for children received an approval to send about 26 supplies to North Korea. And we are exploring ideas of how to monitor this delivery. And this is an invitation from DPRK. Personally, I visited North Korea in 2018, and the last time I visited there was 5 years ago. And I visited to these hospitals. As you can see, we have many people who joined us at this occasion from North Korean hospitals. That is why I was able to take a look at North Korean hospital. Since Kim Jong-un seized the power, my impression was the working environment for healthcare workers in DPRK was improved. And since the visit, we've been supplying these medicines to North Korea. And these supplies were purchased in China and that was delivered to North Korea by land. And there are some exemptions provided by UN. So in November 2019, we received this sanctions exemption. And in August 2019, we also received sanction exemptions for dental equipment. But the dental treatment items will not be able to send to North Korea for some reasons. And it is consisted of 26 supplies, as you can see on the screen. And our plan was to provide those supplies to 9 provinces in DPRK. Our plan was to deliver 26 sets of these supplies. And in 2018 and 2019, besides the supply delivery, we started our human resources exchange. And as you can see in the picture, the FIP was held in Abu Dhabi, and healthcare workers of both Koreas were invited to FIP, and we had a time to network there. Since Kim Jong-un seized the power, it was quite clear that things have been improved for healthcare workers. But let's take a look at the healthcare environment in DPRK. And international agencies have been actively reporting health indicators of DPRK. And almost every year, the relevant or associated reports and statistics and indicators have been published. Based on these indicators and published reports, you can see North Korea's life expectancy and infant mortality and mortality rate of children under the age of 5. There is a big discrepancy between both Koreas. And infant mortality rate, the gap is 0.6 between 2 Korea. And next is maternity mortality. And the gap is 8.1 between the 2 Koreas. If you look at the figures and numbers, you can see there is this correlation between the economic power of a country and the healthcare indicator. In North Korea's per capita GDP is about $3,000, but that of South Korea is $30,000. So we need to take a closer look into these indicators. Let's take a look at the North Korea's environment further. And North Korea suffered and experienced the so-called arduous march or march of suffering. And in 2015 and 2020, the healthcare-related indicators or child-associated indicators have been improved. And the mortality rate of children under the age of 5 has shown a big difference from that of South Korea. In 2010, it was 7.3, which was a big improvement in DPRK, and WHO recently published the number, and the number indicated things are getting better in DPRK. And the mortality rate of the children of under the age of 5, the blue line is the average number of developing countries, and the orange line is the average of advanced countries, and the red line is the average number of DPRK. And DPRK's number is higher, is lower than the developing countries. But the comparison between North Korea and South Korea continues. So North Korea, DPRK needs to improve, but we have to take an overall look at this. Since Kim Jong-un seized the power, we can see a clear sign that the healthcare environment is getting better. And the per capita, the per GDP of underdeveloped countries is about $1,300, and East Timor and Pakistan can be comparable to DPRK, but fortunately, DPRK's healthcare indicators are much better than these two countries. So there is a close relation between the economic situation and the healthcare situation, as you can see in countries around the world. And DPRK has overcome the healthcare issues and the malnutrition issues since the arduous march, and this is the result of the joint effort of the people in DPRK and the government there. In the third committee meeting that was held recently, the North Korean party decided to increase the healthcare environment, and it decided to provide nutritious food to children in daycares for free. So some modernized business has been actively carried out in DPRK, and from the middle of October, for baby formula in large amount was purchased and sent to DPRK. And this is about the budget of North Korea's healthcare expenditure. Mostly the average number was 2%, but in 2012, the expenditure increased by 8.9%. In 2020, it was 7.4%. And this year's budget is 2.5%. It was reduced due to the COVID-19 pandemic. Since Kim Jong-un seized the power, he must have faced this dilemma. Since he took the power, as you can see here, the indicators peaked and then it has continued to go up. So during this period, the nutrition provided for children and women have been improved, but non-infectious disease indicators have been worsened. And this shows the limit and the improvement in healthcare indicators in DPRK. This requires a better situation in DPRK. But it seems the North Korean government realized that humanitarian assistance can do only so much, so it has to develop its economy on its own. So North Korea government declared it will stop assistance from outside world. As you can see, right before the COVID-19 hit the country in August, North Korea asked for reduction in the residential international cooperative agencies staff in the country. In 2018, there were inter-Korean summit meetings and summit meetings between North Korea and the U.S., but it ended up with failures. In December 2019, the UN sanction 2379 had a severe impact on the country because it took more than 6 months to get approval from the UN to send these supplies as a sanction exemption. But as COVID-19 hit the country, the North Korean regime is facing a more severe situation. So we have to think about how to overcome the situation working with North Korea. So let's take a look at how North Korea is responding to the global COVID-19 pandemic. I'd like to share my personal insight as a person who experienced in sending supplies to North Korea. In January 2020, North Korea tightly shut down its borders, and it sent the disinfection guidelines and other procedures to disinfection officers. In North Korea, receive supplies by land, by ports, and through borders, and they should be disinfected. They are using disinfectant, and they are using spraying and fumigating disinfection methods. They are applying these disinfection methods to all supplies and all transportation methods and means. And fumigating disinfection is used for supplies and deliveries that the humans have difficult access to. And the second disinfection was also carried out. They let the supplies dry naturally for like 10 days. And then in 10 days, the third round of disinfection is provided, which involved fumigating disinfection. And the disinfection officers also take a closer look at the supplies so that they can make sure that all the supplies are disinfected. In 2021, there was some changes, and they are using some sanitary measures, and they disinfect the supplies for 2 hours. And they use high pressure moisture spray, and they let the supplies dry in natural environment for 30 days. To prevent Delta mutated virus, the number of days for natural disinfection will be lengthened. They are doing all of these measures because they understand that COVID-19 virus is vulnerable to heat. So North Korea is trying to make sure the virus is not penetrating the country. So the country is on lockdown. Why is North Korea working so hard to prevent the global pandemic? I have been looking at so many data, and it's my personal opinion that North Korea is looking at the domestic situation, that it has to prevent and respond to COVID-19 with its own resources. And North Korea has to prevent COVID-19, and it is desperate because it has these collective measures. In spring and autumn, all the people are mobilized to do the agricultural work. And the North Korean regime thinks COVID-19 can make or break the regime itself. And I believe North Korean people are afraid of their weak healthcare system. Once it is collapsed, there will be no recovery. And they are thinking that vaccine is not a solution to COVID-19. And they are also afraid that the infectious disease can be used as a lethal measure against the regime. And there is this need for the regime to definitely prevent the COVID-19. They need more time to improve the inter-Korean relations. So the North Korean regime is spreading propaganda to be against the COVID-19. So humanitarian assistance and exchange may not resume immediately, at least until next year, because of the current situations in DPRK. So my point is, COVID-19 is an unprecedented situation, and North Korea is under severe UN sanctions. So we need to do more to improve the current situations to help North Korea. That's all I have. Thank you very much.
An overview about North Korea's public health system. And it was particularly insightful, I believe, because she covered the recent trends and the kind of differences that has emerged since Kim Jong-un came to power. And also, it was nice to hear, as Dr. represents South Korean NGO engaging in humanitarian assistance with North Korea. It was very interesting to hear about some of the plausible scenarios behind North Korea under COVID situation very recently. I look forward to some discussions on these points later in the Q&A session. So our final speaker is Dr. Eun-ha Chang, Director for Center for International Development and Cooperation at KWDI. I'd like to invite Dr. Chang to begin her presentation, which is titled Recent UN Documents and Situation of Women and Children in the DPRK.
Hello, my name is Eun-ha Chang at Korean Women's Development Institute, as was introduced. Today, I'm going to speak about my personal interpretation on recent UN documents and situation of women and children in DPRK. Even though my title goes like this, I would like to look at 2 points today. Actually, I had these 2 questions in mind when I was preparing for this short presentation. First, maybe you can think about these questions along with me, considering all the previous presenters. And this is just I don't have a definite answer, but these are 2 questions that I like to continue to think about when we discuss humanitarian challenges in North Korea in terms of women and children. So it goes like this. Can international norms help DPRK government and international actors to enhance the humanitarian situation and the rights of women and children in North Korea? That was the first question that I wanted to address in my presentation today. Second, how can we draw some gender perspectives on DPRK's humanitarian situation from the discussions today, meaning the previous speakers? They talked about very specific situation, broad situation, some public health situation, etc. And what are some gender implications? So these are 2 questions in my mind. But I have to begin with a little bit of hesitation, because whenever, as a researcher, whenever I try to look at North Korean situation, I become a huge, I hit on a huge brick wall, meaning the lack of data and lack of exact data and statistics hinders any sort of very rigorous analysis about North Korea. And this is a fundamental dilemma for a researcher like me. So why do I say this? Because in addressing these two questions, I encounter the same problem, and that kind of really it holds me back when I wanted to say something, anything about North Korea. So having said that, let me share with you what little and what information I had, and then the interpretation for that. So this is DPRK needs and priority plan published by UN in 2020. And I won't go into detail because previous speakers have already mentioned about these in more detail. Just wanted to point out the 3 priority areas mentioned by this plan, which are food insecurity, health, clean water, and sanitation. This report clearly states that these are the 3 areas that this report is focusing, especially in terms of SDG goals. It will be Goal 2, Zero Hunger, Goal 3, Health and Well-being, and Goal 6, Water and Sanitation, so WASH sector. For my analysis, I refer to the most recent document, one of the most recent documents published by the DPRK government, which is the Voluntary National Review on the Implementation of 2030 Agenda. This was published in July 2021, so this is just out of the oven document. Maybe I won't go into very detail, but let me share with you some of the features that I discovered and some of the gender as well as humanitarian aspect, which are the topic of today's discussion. So feature, I was very surprised that this is a very, very unique VNR reflecting North Korean system and ideology. So it's a very unique interpretation to begin with, of the SDGs in their own way. It seems to be grasping the essence of SDG spirit and values, leave no one behind, so for example. But North Korea totally changed SDG format to suit DPRK's values and systems, including the Juche philosophy. It has 17 goals, 95 targets, 132 indicators, main 4 areas: energy, agriculture, WASH, environment. Also, it does have a gender goal, which I found it very important, and I was very happy to find this, is Goal 5, consolidate gender equality and rights of all women and girls. And these are very similar wordings as global SDG. And then gender is mainstreamed in several other goals. For example, health and livelihood, health and in the later part, inequality goal. They don't use inequality, it's goal 10, but different wording. As for the humanitarian aspect, they address these in several goals. For example, goal 1, livelihood. Goal 2, agriculture and food. They use a little bit different wordings. Goal 3, well-being, which is health. Goal 6, water. And then in Goal 3, they specifically mention about this current pandemic. So it goes construct solid basis of the anti-epidemic, so which is obviously referring to the pandemic situation. Here, I'll very briefly go over the Goal 5, which is the consolidate gender equality goal. I don't have much time to go all of this, but I want to emphasize if you look at the progress and challenges that DPRK government actually, these are the wordings of the DPRK government. The first one, DPRK has achieved gender equality long time ago. and the targets has been already achieved. Women have equal rights with men. So they talk about the great equality system that they have. But here in this slide, I want to mention just one thing, which are, it's like my bullet points down somewhere, mental and physical violence is not a social issue in the DPRK, where the people are masters of everything and everything serves for people. And this, I would like to focus on this. They don't have any violence issues in North Korea, and that this is openly stated in this VNR published in July. Why do I emphasize this? I'll talk about it in my next slide. Okay, so again, some gender perspectives. I won't have time to go into all of detail, but you can actually look at it. But in line with what I've just said, I want to take attention on goal 5, which is about the gender goal. The gender goal, they have put everything nicely. They talk about sexual and reproductive health and reproductive rights. But here, I'd like to emphasize that gender-based violence issues, which are the main 2 big targets in global SDG 5 goal, 5.2, 5.3. These are 2 targets in global SDG goal 5, which tries to tackle the gender-based violence issues. But in DPRK's VNR, goal 5, which is on gender, they do not at all talk about the gender-based violence issues. And they just keep saying that they don't have any violence, especially domestic violence and sexual violence. And they only include in this goal 5, early marriage issue. So I want to point this out. And this is like the basic position of the DPRK from my previous experience of exchanging opinions with the DPRK researchers. They also mentioned in the same line. Now, I want to talk a little bit about how we should, now we've heard the experts speak about the DPRK situation on women and children. Here, I'd like to throw this frame kind of to accelerate or instigate our thinking, how to frame our perspective in DPRK situation. Maybe we talked a lot about the vulnerabilities that North Korean women and children face. And this is usually what happens when we talk about North Korea's humanitarian situation. But I'd like to, this time, focus more on capabilities. What kind of capabilities have North Korean women shown during this difficult time of chronic humanitarian crisis, and also adding on to that, this pandemic situation. Women's vulnerabilities during disasters or conflict situation. These are some of the general phenomena that you can actually face as a woman in that general, conflict or natural disaster situation. And then I would like to actually consider North Korean case in this kind of framework. So women usually face safety issues. They become vulnerable in terms of safety, high risk of exposure to sexual violence such as rape, domestic violence, etc. They face economic vulnerability during times of humanitarian crisis, which increases female-headed households because men, they are out there fighting wars and some men die, or men migrate to other cities. And you see a lot of single female-headed households. And many humanitarian assistance initiatives are given to this kind of women who are facing economic vulnerabilities. Health vulnerabilities, you have physical as well as psychosocial vulnerability. Here, I'd like to revisit our previous discussion and see North Korea, from the VNR, and also from the previous speakers, we recognize that women face economic vulnerability as well as health vulnerabilities. But North Korea doesn't mention about this safety issues like the gender-based violence issues, not in their VNR report, and it's very less talk about among these experts as well. As for the health vulnerabilities, they talk a lot about reproductive health of women. For example, like maternal mortality, anemia of pregnant women, etc. But rarely the psychosocial, the mental health aspect of North Korean women is also neglected. So vulnerabilities, not only due to biological differences, but unequal relationships and power inequalities between gender situation. I'd like to suggest that we look at North Korean women's situation from this lens, the vulnerability, when we look at the vulnerability. Here, I would like to actually gear our attention to capabilities. What do women usually show capabilities during this kind of crisis? They are usually leader and information provider in the community. So maybe they are not the leader at the state level, like a provincial level, but you can find that within their community, you see many women playing the leadership role. And they have a lot of information surrounding their like villages or communities. So when a disaster hits, women can provide a lot of leadership and also information in this kind of situation. So this is what women can do, actually. And disaster can be an actually opportunity because for women to actually step up and show their capacity during these difficult times. And I believe the North Korean woman has shown this kind of ability during this chronic humanitarian crisis as well as pandemic situation. And then this would be my probably last point. I want to actually throw this question that, we talked about how women are vulnerable in North Korea. And also we talked about how women were capable because we saw a lot of women peddlers, during these difficult times, and they have been rising as an economic power actually to run for their family and gain income. And their role in terms of economic sphere is getting bigger and bigger. But I want to challenge how many leadership role or decision-making role do they play in their community, in the state making, or in that area? We really have to look into. We don't have much information, but I think people who are actually on the ground, who have been working in North Korea, inside North Korea, who had a chance to observe what was going on the ground, maybe they can give us more information of how women are playing the leadership role in their community, and maybe upper levels. That would kind of give us an idea. So here I'd like to wrap up my presentation, throwing the challenges of identifying women's capabilities in North Korea. Thank you.
Thank you very much for your presentation. It was nice to hear Dr. Tang drawing implications, gendered implications from the humanitarian situation in the DPRK, as well as drawing implications from the recent report published voluntarily, a voluntary national review on the implementation of the 2030 agenda. Also finishing the presentation with some of the capabilities, highlighting capabilities of women and what meaning that might have for the future. So now I would like to open the floor for general discussion. And while we wait for some of our participants to post their questions online on the chat box, I would like to raise a few questions myself. And after I do that, after I pose a few questions to the presenters, I will go around and ask the presenters themselves to raise any discussion points or questions for other presenters if they have any. So please take some time to think if you have, if you would like to raise questions for other presenters. And then at the end of today's session, webinar, I will go around and give each presenter, each speaker about 2 to 3 minutes to comment on some of these questions and comments. So if I may, I have a few questions for the presenters. So while I was listening to Dr. Sang-Soo Lee present, the presentation ended on a positive note, talking about when borders open, when North Korea engages with the US. But then I was thinking about what we could do now in the current situation. And then maybe when the borders open or when the relations normalize, I guess we have different options depending on these scenarios. And so for now, I'm curious what we could do now, if there's anything we could do now. And particularly because you talked about the high level of women's labor force participation and what this means in North Korea, I was wondering, particularly focusing on labor force participation, women's economic empowerment and participation, if there's anything you think we could do now to assist this process, or maybe there isn't anything we could do now, but then when the borders open up, then what should be our intervention strategy, if you have thought about this? And then my questions to Dr. Nagi Shafik was, because you have been in North Korea from 2006 and 2009, you managed the project Improving Women and Children's Health in DPRK. And so could you tell us anything from your experience based on this project specifically? What lessons learned? What should be some priorities concerning women and children's health? I'd like to hear a little bit about your experience from this. So my question to Ms. Wallström is, I was intrigued by the point that you made about women's economic empowerment and how that makes a difference, even not just in democratic and developed states, but in other states, in all kinds of states. And so I think this is kind of similar to some of the questions that I had while listening to Dr. Sang-Soo Lee's presentation. But given that women's economic empowerment is important and that it makes a significant difference in socially as well, what do you suggest as a way to support and assist women's economic empowerment in North Korea in the future? If you had thought about specific ways you could do this, or the international community could do this. I had a question for Dr. As well, and so I noticed while I was reviewing the humanitarian assistance projects that have been performed, that have been undertaken since the sanctions. So we're talking about recent 2-3 years. I noticed that actually there are quite a few projects approved by the UN under these sanctions, quite a few projects on targeting mothers and children's health specifically. And because you are a health expert and you have been in the field multiple times, I was wondering if you could talk a little bit more specifically about mothers and children's health and current situation and what should be the priority in future projects. So these are a few questions I have for now. Now, may I invite all the speakers and see if you have questions for each other. Anyone?
I do. I had a small question for Dr. Shafiq. While I was listening to your presentation, I was wondering, you talked about UNICEF sending refrigerator for the cold chain for the mRNA vaccine. And considering that this is a heavy sanction, I heard that like metal object cannot be transported. But how can that happen? Was my very simple question. Yeah.
Should I answer now?
Yes, please.
Okay. When I said about this possibility, because many people talk about the United States are offering mRNA vaccines to DPRK. So if it is the United States offering this, they will, consequently, they will say it's no problem to provide some refrigerator. This is temporary situation. And I think that they showed some kind of flexibility regarding the situation during the pandemic.
Okay.
I see.
Yeah. Thank you.
So would anyone else like to pose a question to other speakers? Please, go ahead.
I just want to add one thing because Dr. Chang was mentioning about the gender issues there. And on the positive side, I would like to say from my own experience in North Korea that there are few things I can mention. For example, the DPRK is one of the countries advocating for education, not only boys, but girls also. And you don't find any difference, which you can find all over the world, about girls are not as educated as boys. In DPRK, the situation is better. Number two, also, the age of marriage of girls. Also, this is some kind of respected in DPRK, not like many countries, including the areas I'm living in. And also, if you look from the health perspective, you have in each province, you have 3 main hospitals, 1 general, 1 maternity, and 1 pediatric. That gives you also an indicator how much they care for maternal health and children health. And finally, also their contribution financially also in the vaccination campaigns. That's also one of the indicators that really they care about children and women. That's just a comment. Thank you.
I see. Thank you. Well, actually, we are close to the end of the program. So can I ask each of the speakers to give your final comments and remarks? I mean, feel free to answer my question. But you don't necessarily have to feel pressured to address the question I raised, but please give a maybe 1 to 2 minute final remarks. Could we start with Dr. Sang-Soo Lee?
Yes, thank you very much for today's great webinar. This event gave a fantastic opportunity for all of our speakers. I believe we shared our insight and our perspectives. I learned a lot, especially I'm not an expert on gender or humanitarian aid either. But we talked about a lot about international communities humanitarian aid. But unfortunately, due to the COVID and North Korea's self-imposed the restrictions, most of international aid cannot be delivered. But we mentioned many reasons and backgrounds and our perspectives. But from a political perspective, from my perspective is North Korea, their priority is actually security. Since the regime has so many times emphasized first thing U.S. or international community should do is removal of hostile policy. Sometimes I see North Korea, why they are refusing humanitarian aid is also related to this, their policy priority. Even the international community, when they try to send the vaccine, but North Korea see this vaccine aid, even they see as political intention. For example, normally vaccine aid, the monitoring system is attached. And then international UN organizations, even though they are still so a bit low profile, but there should be some condition to send staff for monitoring work. But this is very sensitive to the regime, especially after the failure of Hanoi summit. Every internal information, they are so cautious or concerned if any information could be leaked. If international monitoring staff see the internal situation, North Korea, if very much suffering from economic difficulties or human rights situation, then it could be used by the US, not fully, but maybe they can argue, oh, the sanction is working now. And then it's actually the most regimes concerned under this situation, because their priority is to solve their security issue first. So those humanitarian aid also under this situation is also hindered by this political situation. So what we can do is, I think it's the priority is to rebuild trust between North Korea and the international community. And then I hope the future dialogue will be resumed soon, bilaterally or multilaterally. Then I think North Korea always said if security is solved, then everything could happen, including low-level cooperation, including humanitarian aid. So I hope those political issue, nuclear issue, if it is solved, not fully solved, but at least certain trust will be built between different actors, then maybe North Korea feel a little bit relaxed and try to reopen the border and receiving international humanitarian aid. So that's my short remark. Thank you.
Thank you. Thank you. Dr. Shafiq, would you like to add anything to what you said previously?
I just received some questions from you. You want me to answer these questions?
Yes, please.
Oh, you asked about while I managed the project of MCH project that was funded by the Republic of Korea,
Yes,
right?
yes.
Okay, this project, very briefly, that it was the first chance, it was a very big funding in the history of the organization, and it was the first chance for the DPRK health managers to look at the long-term vision of health system. And it was also within the framework of WHO building blocks of health. And it had, we call it maternal and child health, but actually it was about the health system. So that improve the health system so it can better serve women and children. And it has something to do about capacity building, management, information system, infrastructure, medicine capacity, and equipment. And the results of the project was very quick, and it helped also to open the eyes. It was a model for the managers of the Ministry of Public Health, and they started to try to apply it in a smaller scale in other places where we couldn't extend to. And there was also an external evaluation made by a group of researchers from Melbourne University, and they recommended that in the future we can have a bigger project to improve the performance of the health system. But there was only one problem, is that during the time I was going to Seoul many times for also reporting, and it was something like the political issues were hanging over. I mean, when the political situation is good, everything is fine. And when I go and the political situation is bad, I found impossible questions for me. Okay.
I see. Well, thank you for sharing this story. Ms. Wallström, could I ask you to deliver your final remarks?
Yes, good. First, I also want to thank for a very, very interesting seminar, I must say. I also learned a lot, particularly from colleagues talking about the health situation. I'll just make 3 quick points. I'd like to go back to the question that Dr. Chang asked. Is DPRK willing, interested? Can we engage them with international norms? And of course, the answer is yes. And I think just what Dr. Shafik have talked about this, I would say that I have found that they are extremely anxious to learn to appropriate, just like any other country, what they know they need. I have found that in all my different jobs in the humanitarian and disaster risk reduction. That is a very strong foundation for cooperation. And I think it's a country that essentially, in my experience, they asked for what they need. Maybe they don't accept everything we offer, but that's probably wise. So given the situation, definitely the answer is yes, the utilization of international norms can assist. Secondly, and I apply that to the issue of women's economic, or I would say women taking greater space overall in leadership. And again, legally, of course, it's a perfectly equal society. It's in the national law. The equality is a sort of a policy. That's why they don't discuss it. But that's not really the issue. The issue is the social norms, the cultural norms that that sort of rules the situation all the time. And that's where this issue of domestic violence. And so I think in my short experience in talking about this issue on leadership and ensuring that women take leadership roles, because they aren't very visible. Of course, they are middle-level senior managers when we cooperate with them in national institutions and also when we employ national staff. But it is a rather small minority, I would say. But I'm sure it's different in different professions. Maybe in the medical profession, there are many more, and in the education system, I would think. So I think we need to we need to, as is very often the case, approach this from the perspective that it's good for the entire society. You know, the simplest version of this is you have 100% theoretically pool of human resources that are highly educated, well educated in an equal system. Why do you only use 50% of them? If you used 100, your country would make much faster progress. And this is, you know, it's not uniquely about women's role, but it is about women as a force for economic, social development of the country. So that's one of the approaches that we take when we do this work. And I think that we can make progress with this also in our discussions and our cooperation with DPRK when it takes off. Finally, and Dr. Sang-Soo Lee, you also discussed this issue, why not do what appears so obvious, allow the vaccines with the cold chain, because sanctions would be, everyone is eager to do, US included, but also many others, we just want to do it. But no, the first priority is security and the national interpretation of what that means. And so I very much agree with this position that our first priority must be to rebuild, or whatever you are in a situation, the confidence with the authorities. In a separate discussion, we actually noted with Sang-Soo Lee also that in all likelihood, when we return to DPRK, we will meet many new officials. They are changing people. There will be new people to meet in the jobs that we before. So that's the first step. It's to rebuild those linkages and the trust in the cooperation. But I also want to mention that there are conditions to the humanitarian support, and this is because with some regularity, as also Dr. Shafik hinted at, there is a crisis in confidence and cooperation. And about 10, 15 years ago, the UN was expelled from the country, actually, for a short while. It took quite some negotiation to, again, allow us all to come in and work with them. So the condition simply, it's not a positive condition, but it's very simply that we can work in the country, that we can follow how aid is distributed, and that it actually complies with the agreement that we have of the groups that are targeted and the regions. And that conditionality of a presence in country is actually very much motivated by the concern for, it's a bit of a gap of trust, of course, but it's a gap of trust based on experience. And the limitation, as I mentioned before, DPRK would like to have development cooperation. That's their top priority also when it comes to what we do in the system. But it cannot be given because of the political situation of the countries. We have to do humanitarian assistance, and we are trying to make it go as far as it can in terms of using it also for things that are really important for the long-term future for people, the health system, the basic health system, the basic water sanitation system, and the capability for disaster preparedness. Thank you.
Thank you. Thank you for your insight. Dr.
아시겠지만 2017년 12월에 유엔 결의안 2397호가 채택이 됐고 실제로 유엔 면제 승인이
The UN Sanction 2397 was launched, and about a couple of years later, the sanctions effect was felt, and South Korea's assistance organization had to get approval from the UN to send supplies to North Korea. But since then, the supply have been stopped due to the situation, and many people have been expecting the North Korean borders will be opened, but it didn't happen. And in July 2020, we were told that some of the ports of North Korea were opened, so that is the channel the WHO's and UNICEF's supplies and goods were delivered through. The problem is that North Korea is applying very strict quarantine measures, so there is a limit in reality. So without any substantiated or substantial results or outcomes, things will not get improved. And regarding priorities, health is correlated to food security and immunization. So in immunity, so I think food should be a top priority. I'm working in healthcare field, but I'd like to emphasize the importance of food security.
세 가지 말씀드리고 싶습니다. 먼저
North Korean women, because identifying their capabilities, we can then go into the rights-based approach in development assistance and humanitarian assistance. Second, I'd like to point to the hidden crisis that's not really visible, but there, which is gender-based violence and other violence issues, because, and this is about social norms, cultural norms that Ms. Wallstrom has actually emphasized. My third point is that in dealing with North Korea, we really need the help of countries that North Korea feel comfortable with, such as Sweden and Egypt, all those North Korea friend countries. So, yep, that I'd like to mention 3 points.
Thank you very much. Now, actually, we're really coming close to an end of today's program. I would like to invite Loveless, Junior Research Fellow of the Stockholm Korea Center at the Institute for Security and Development Policy to deliver closing remarks from Sweden. Loveless, are you here?
Yes,
Oh,
I
you're
am
here. Okay, then before you actually begin speaking, I'd like to give a brief background to our audience. So KWDI, our team has been working closely with the ISDP for a few years now. And this year alone, we actually collaborated on 2 webinars. One was held in May, and the topic then was women, peace, and security in Asia and Europe. And ISDP and KWDI, we co-hosted a webinar. And this webinar on humanitarian situation in the DPRK is our second collaborative effort. And neither of these forums would have been possible or successful if Loveless hasn't been so passionate about realizing our ideas into an official forum like this. And so I'd like to invite Loveless to give a few words before we end.
Thank you so much, Dr. Yoon, and thank you for those very kind words. Your wonderful moderation today has contributed to a very great seminar. And on behalf of ISDP, thank you also to all of our distinguished speakers who have contributed to this very insightful and important seminar. I also want to thank the audience for your participation, and a special thanks to KWDI for co-hosting this webinar with us, and for great cooperation on peace and security issues as always. In the interest of time, I will try to be brief and say just a few words as a closing. Today, we have learned about the humanitarian situation in North Korea, and even more about the specific situation facing women and children in the country. Our speakers have provided very valuable and rich presentations in everything ranging from vaccine capabilities to the role of women, the health and medical conditions of the country, and the challenges in providing adequate humanitarian assistance amid the current lockdown. And I am especially glad that we could keep this very broad approach, because even though it may be hard to have all the information about the situation now, piecing together different bits of clues and data of what we know and what we have known in the past is the best way to gain a comprehension about the current situation. The pandemic has had detrimental effects all over the world, and as we have learned today, and as you also might have known before, North Korea is not an exception. In North Korea, as we all know by now, it has exacerbated an already dire humanitarian situation in the country, and not specifically because of the spread of the virus itself, but rather because of the measures taken in response to it. So during this seminar, we have heard about the full-scale border lockdown, the travel restrictions between different cities, and the restrictions on imports of non-essential goods, including humanitarian supplies. And we have also heard how the humanitarian situation in North Korea was already negatively affected by sanctions and natural disasters even before the pandemic. When faced with such changes, humanitarian challenges, and also more restrictions, a shift in societal dynamics may be expected, and usually that shift has gendered consequences. And this is something we see all over the world. And this is what brings me to our main aim of this seminar, which is looking at the specific consequences. The gendered aspect of humanitarian crisis is often overlooked, and that is why dialogues like these are so important. Without understanding the specific vulnerabilities, but also capabilities that women have in times of crisis, stakeholders or actors that are interested in engaging in the country will not be prepared to provide adequate humanitarian assistance once the country gradually reopens. And I would really like to highlight this capability approach here that Dr. Chang highlighted as well, because as we touched upon during the discussion, if we only see women as victims of a crisis, that may prevent us from seeing their agency and many assets. And that goes for the public health capabilities in the country in general as well. At last, I would like to say that sharing information and identifying the main challenges that women and children in North Korea are facing, like we have done today, is of such great importance, and continued dialogue is really necessary to help actors to be ready to act quickly in an inclusive and efficient way based on the assets and capabilities that have already been established among women and local communities in North Korea. This way, not only immediate relief can be provided, but also actors may be better equipped to cooperate with locals in building the foundation for a more empowered and equitable society moving forward. Currently, it is very hard to gain information on the ground, but just because it is hard does not mean that we should stop trying. So I thank you all for keeping this important conversation alive, and I wish you a great day and evening. Thank you.
Thank you. Thank you very much. And with those final words from Loveless, I now close the webinar on humanitarian challenges and gendered impact, vulnerabilities and capabilities of women and children in DPRK. It was great having you all with us, and thank you. I'd like to thank the presenters, the speakers, for your contribution. Thank you very much.
Thank you.